Health Partnership.
Great, thank you so much, Veronica, and hello everybody. Thank you so much for joining us this lunchtime. Happy International Men's Day. The answer to the question that often gets asked when it's International Women's Day, yes, but when's International Men's Day? Well, it's on the 19th of November every year. So my name's Matt Williams, and I am the Senior Programme Manager for Mental Health with Health Innovation Oxford and Thames Valley. And that's an organisation that engages with innovators in healthcare across the NHS. So I work within the NHS in my day job, but I am also a Samaritans volunteer of 15 years standing. I'm the chair of the Thames Valley Suicide Prevention and Intervention Network, the co-founder and chair of Oxfordshire Men's Health Partnership, which is why I'm presenting today. And this is a subject that is always close to my heart, something that I talk about an awful lot. And I've recently become the trustee of the Corner Men, which is a suicide reduction charity based in South Oxfordshire, aimed at men, and we're based out of South Norton Boxing Club. So I've been working in the men's health space for about 10 years now, and it's really amazing to see so many people engaging with this. I think we've got just hit 31 participants this afternoon, and the number is growing. So as Veronica said, we're going to record this session, and then if you've got any thoughts, any comments, any questions you'd like to add, pop them in the chat. If you don't want them attributed to yourself, then when you go in the chat, deselect engage everyone in meeting and send it to me, and I'll manage to address those in the second half. But it gives me great pleasure just to let you know how we're going to structure this recorded session. I'm about to invite Adil to tell his story. He's very generously given up his time to talk about his experience as a man seeking help in the mental health sphere, and just help seeking in general. We'll also hear from Ben Ssentume, who is an excellent colleague from Oxford Health, who's a clinician, but also working in the field around suicide prevention. And he's also very interested in men's health and the experiences of men from all different backgrounds. Mental health is something which is sort of culturally complex, but something that I'm told frequently when I mentioned that I work I have an interest in men's mental health. People say men don't talk, do they? And indeed, on International Men's Day, we'll hear a lot about the need for men to open up and talk more. I think that is important, but I also think it's really vital that when men do speak, that they're listened to, that they're heard, and that they're responded to in a way that is non-judgmental and respects that man's autonomy and what have you. Anyway, I have conversations with men all the time, which are involve complicated emotions, difficult feelings. Men are perfectly capable of speaking about their issues, but only when it's safe to do so. So I think I'm going to hand over now to Adil and welcome him to this meeting. He's somebody who will tell his story in his own words. I'll do my best not to kind of go stomping in, but we'll just we'll have a conversation, and I'm hoping it'll prompt and spark a lot of thought and idea. So welcome, Adil. If you could just let everyone know who you are and give us a bit of background. Give us your story. What happened to you, and where did you commence your journey, as it were?
Hello, everyone. My name's Adil. Thank you for having me. This topic's quite close to my heart, and personal experience of going through the experiences that I have. It'd be a pleasure to share them. I'm 47 years old. I've been in Oxford about 20 years, and roughly about 4 years ago, unfortunately, I lost my father. 4 years previous to that, I had lost my mother unexpectedly. And a week after losing my father, my ex-wife of 17 years decided to end our marriage with very little explanation. It was a very traumatic time for myself, probably one of the worst times in my life. I was trying very hard to be strong for my three children, who relied considerably on me for emotional support, physical support, day-to-day care. With very few options, we continued to live in the same house, although we were separated, which was an extremely stressful environment with very little communication day to day. So I was struggling extremely with multiple issues, predominantly the bereavement initially, which I was going through feelings of extreme loss, as it was my last parent. Um, Additionally to really my surprise was that I started having an identity crisis as a result of the losing my father, which really required myself some space, some safe space to understand it and to work through it. Coupled with the toxic breakdown of my marriage, it was quite a disastrous time and situation emotionally. Um, I've always been quite a self-aware person. If something changes in me, I tend to know that I need to go and look for help, which is quite a blessing in that respect. I think it's something which is innate in myself and my personality. I realized I wasn't the same as before. There were extreme feelings of helplessness, and abandonment. This created a very low mood, which brought on extreme anxiety. Um, it was even preventing me from doing day-to-day things like going in lifts. Um, Sort of getting on a plane was extremely scary and frightening. Um, the anxiety created incredible amount of fear. From a cultural perspective, it wasn't really commonplace, especially coming from an Asian background, particularly. My parents coming from an Asian background, to discuss any feelings which might be seen as negative, possibly as a weakness. I couldn't really discuss any of the marital breakdown issues or any of the thoughts I was having with my siblings or wider family, purely as it felt like I'd failed in this journey.
Thank you. I mean, it's that's so helpful, and so many things you're touching on. And I think it's really important just to recognise that bereavement, for example, has got nothing to do with mental health. Grief and loss is part of the human condition, and I think quite often, when we think about men's health, we sort of look for all sorts of other aspects and issues going on, but actually, a normal part of life can suddenly spiral out of control. And I thank you for being so open about that. I just wondered, in terms of how being self-aware, being aware that things were you had multiple things going on. How did you seek help, and what were you perhaps concerned about, worried about when you were, particularly as a man, opening up and seeking help? How did you start that journey?
Um, it was a very confusing time initially. It took me a little time to approach actually somebody neutral, which was my regional manager at work. Um, I needed his support because I was going through so much. I needed time to step away from work to be able to digest it. He encouraged me actually heavily to approach my doctor, which I had never thought of originally, and I did. My initial um, idea was for going to get a magic pill, which would cure me for depression and anxiety, which was infecting my thoughts so much. To be honest, it was just pleasant to have a chat with the doctor. His attitude was very calming and reassuring. Again, this was to my surprise. It really did feel like it was a safe space. He suggested initially bereavement counselling to help with the deal with the death and the other issues that were surrounding my father's death. I also did a test for anxiety, and I was diagnosed with this quite extreme anxiety. I was referred to Mind. He signposted me to Mind, and I did attend a session and took away literature and links, which had access to exercises to help with breathing techniques during the episodes of anxiety to help deal with them. Hopefully, they would dissipate. But I felt this really wasn't helping, and I was doing everything that was advised. There was no real offer of like regular counselling on a regular basis. I went back to my work and I approached them, and they kindly stepped in with counselling and support on a regular basis. I went back to the doctor, and I'd explained to the doctor what I was doing on my journey through this, and that I was still suffering from low moods, which was starting to take over day-to-day life, being completely low, feeling that anxiety at a very low level. So he suggested taking medication. And I was very apprehensive because of stigma around antidepressants, what I'd heard and what the side effects might be. He suggested a drug called citalopram, and he explained it was non-addictive and what it was originally designed for, what it was used for, and I could take it for a long term, and it would take time to build up in my system, and I trusted him. So I went on that journey with citalopram, but within a month, um, it certainly helped regulate my mood and stabilized me more of a base level. So I was better prepared to deal with the other issues and seek further help and support. So I wasn't as confused, and there wasn't so much anxiety and confusion. During those periods, I've sort of worked for roughly a month initially. The doctor kindly called me every 3 or 4 weeks on a Friday as a welfare check, just to touch base, see how things were going, which was extremely helpful.
I mean, it's so good to hear. I mean, a real mixed bag there. Like you said, there's kind of that opening yourself up. You don't really know what to expect. It sounds though actually felt pretty good that the doctor was there, listened to you, provided that safe space, and you were suggested sort of sending you in different directions, lots of different things. And it sounds as though some of them were more helpful than others. Ultimately, just on your reflection going back, what was really helpful to you? What was it that kind of started to change things? I mean, I think you've touched on some of those already, but it'd be really helpful just to hear that part of your journey, the next step forward.
Yes, I mean, I kept regular contact with my doctor throughout the whole process because I felt comfortable enough to approach him. His manner was very good with me. I did reach out to my siblings and my sister after I stabilized my emotional state with the citalopram helped considerably. And my sister actually recommended that I try hypnotherapy. And she's a lawyer in the city, and her clients have tried it for various things. And I was apprehensive, however, because again, stigma around hypnotherapy. I was concerned what it was. But I was so desperate for anything to make a difference and get back to what normality was for me. I did go, and I had 4 sessions over 4 months, and over progressively, I became more and more comfortable with hypnotherapy. And I have to say, by that point, all my symptoms had improved by probably well over 90%. I credit the hypnotherapist for saving my life, really. I started having a taste for things which I never thought that I would lose a taste for. People used to say that to me, but I never could understand what that meant. But going through it, it was quite scary, not having the taste for things that you love and every day. I do feel that the medical professionals who assisted my journey did their very best. And I also believe they were limited to the resources that were available to deal with mental health issues that they could recommend or signpost. Even the referred organizations had limited availability and support that they could offer ongoing. And there was a lot of support, which was you had to find yourself from those sessions, which was a bit difficult because often at that point I was quite lost. So I needed somebody to help me with clarity and, really a direction I could follow without thinking too much.
I mean, so much in there, isn't there? And I think just a couple of things. I think there is that issue around stigma at all levels, whether it's about one, putting your hand up and seeking help. Another is about medication. What does that mean? As men, we're often expected to kind of find our own way forward. And I think that what you said speaks to that as well, in terms of there's an awful lot out there. It sounds as though actually your journey of, the things that you were offered, although there were sort of bits of it which are limited, some of them led to, steps, incremental steps towards getting help and support. Ultimately, it sounds as though hypnotherapy and the fact that you said it saved your life, I think that's very, very profound. It sounds as though, that was a really key bit. Just want to come on to that, what you said a little bit earlier about societal expectations, Asian expectations as well, cultural expectations of men. Across the world, men are expected to be strong, resilient, to protect others, to take care of others. And that can actually put an awful lot of strain on that. I just wonder if you could say a bit more about that, that those notions of that pressure of being strong at a time when actually you were dealing with an awful lot.
Yes, certainly, and I mean, I reiterate what I said earlier, and there's certainly there was certainly a cultural influence growing up within a culture where men are considered extremely strong, especially mentally, and this whole idea of like a provider mentality and being physically and mentally strong and not talking about anything negative, which was certainly in my thoughts as it was preventing me from seeking help or even discussing it with my own family, because I didn't want to feel like a failure. But equally, I think from a gender perspective also, I was suspicious. There was a suspicion in me to go and seek help because I didn't want to. I felt from being a man that I didn't want to. I felt like that I would be attacked if I did say that, and that that there was so much more support available, but nothing really for men's mental health. But there was lots for women's mental health, and I thought, well, if I share my experiences, then that stigma might be attached to me through the people that I'm talking to, and possibly follow me through the life. But often I felt like I was wasting the doctor's time, often just to go and have a chat with the doctor, and I felt quite guilty taking up an appointment just to tell him how I was feeling. I think looking back on it now retrospectively, I think it would have probably been helpful if there were non-surgery locations which could have helped with that stigma and guilt of taking up doctor or other patients' time, who might have been more deserving in that time, which I was thinking.
I mean, that's so interesting. I think you're absolutely right that there's a number of things going on. One is a general sort of suspicion about the medical profession. You're seeking help, seeking therapy. What's it going to be like? What's that going to be for me? And I think there is culturally, it's quite difficult for men to find their way through to counselling or therapy. Then I think there is that notion. I quite often, as a Samaritans volunteer, I'm very interested in what people's experiences of phoning Samaritans, for example. I often say to men, I wonder would you ever consider calling Samaritans? And men say one of two things. One is it's not that bad, in that they conceive of Samaritans as being purely there for, the last chance saloon as somebody's about to take their life. And actually, that's not the case. 75% of our callers are going through a difficult time. And it's 25% of people who phone Samaritans in a suicidal crisis. But the other, which really speaks to what you've said, is all I ever hear is that the NHS or health services or the third sector is full to bursting. What about women? What about kids? What about older people? Surely they need support more than I do. Almost that sort of apology for almost taking up space, which is an unusual position, given that often we think about men in society as taking up an awful lot, making quite a lot of noise and taking up a lot of space. Actually, when it comes to help seeking, that's something which I think we need to change to allow men to be more, more vulnerable and more visible in terms of that. And I think you've touched on something else which is really vital, and that is providing health services in locations that are not traditional. Going to the surgery, going to the GP surgery, going to somewhere like the Warnford or Littlemore. If you think about Oxford, these are not male-friendly spaces. These are not places that men feel culturally sort of drawn to and what have you. So I think there's, I'm really grateful. And just the fact that you've spoken today so lucidly and candidly about your experiences will change how people think. And I think we do this slowly. I've been working in this space for 10 years. I'm quite happy to work for another 10 years and longer to change that, so that help seeking for men is less seen as being a weakness, but actually taking responsibility, and actually men putting their hands up and saying, you know what, I can't do it by myself. I realize I need help and support, and I'm man enough to ask for that help. And I would change that sort of narrative. That's really helpful, Adil. Thank you so much. Have you got anything, any last things to sort of add? Any sort of closing thought?
The only thing that I can really think of that might be useful is that when I look back at sort of what other approaches might have helped me during that period, what other resources, but what was really valuable for me was social media,
Uh-huh.
TikTok, Facebook, Instagram groups, because often they're anonymous. I didn't have to. I could join the group, listen to other people's stories. That certainly gave me a lot of solace that I wasn't the only person. The most difficult time, the challenge over the 24 hours of the day to get through that 24 hours was the night times when there's no one around in the night. So there's no resources that are easily walk into and often available after 8 or 9 o'clock. So they were the ones that got through those difficult nights where you're just left with your thoughts and your low mood. So certainly that was something which was useful.
Thank you so much. I mean, that's really helpful as well. And I think it's interesting, isn't it? We talk about mental health, and often social media comes up, particularly in relation to young people's mental health. You know, I do a lot of work in the digital health field, and you know, my sense is that actually social media has both positive and negative, and everything in between. So that's really helpful. And I think that you're absolutely right. You know, that in the wee small hours when services aren't open, that can be the loneliest time of all. And I'm sure we'll be putting a number of sort of charity helplines and sources of support in the chat. Thank you so much.
Thank you.
I think we're ready to hear from Ben, if that's okay. I'm hoping that the technology works. Ben couldn't be joining us today. He's delivering training for Oxford Health, but he has provided a video. So hopefully we're going to be able to play that. And I'm going to give over to Ben. There he is. And I'll see you on the other side of this for questions.
Apologies. I'll just get that back up again.
No problem. It's always a tech, isn't it? There we go.
Yeah. I think it's working. Just one moment.
Hello, my name is Ben. I am a mental health nurse, and my current role remit is around suicide awareness, suicide prevention, and post-prevention within Oxford Health NHS Foundation Trust. I'm so sorry I'm unable to be with you in person today. However, I am hoping that this recorded message will hopefully be acceptable and a good alternative. Matt generously gave me 15 minutes. Thank you, Matt. But this is an awfully very long time to speak to a camera, so I'm going to try and make it 5 minutes and hope that the quality of the recording will be bearable. Today, we are talking about men's health, particularly our mental health, especially with the shocking fact that in England and Wales, for men below the age of 50 years, suicide is sadly the leading cause of death, more than cancer, heart disease, or road traffic accidents. And sadly, the long-term trend is that in England and Wales, again, 3/4 of all the people we tragically lose to suicide are men, the vast majority aged 45 to 65 years. This is truly very sad, and the question we need to ask, we must ask and need to reflect on is why men? Why us? Why does being a man make us very vulnerable to death by our own hand? Unfortunately, there is no simple answer. as we know that suicide is so complex and multifactorial, and each one of us is a complex being who will experience and respond differently to mental health difficulties. However, as you'll hear or you have already heard from different conversations today, there are things that we may need to pay particular attention to when it comes to men, when it comes to us. Personally, I have a keen interest in understanding the intersectionality between suicide and culture, and I've been doing some work around culture and suicide. My experience from clinical practice, as well as evidence from research, strongly suggests that the way we experience mental health problems and our help-seeking behavior, including our interactions with professionals, are deeply influenced by our cultural and social context, including religious beliefs, spirituality, and any other demographic characteristics, for example, gender identity and generational differences. The cultural context will therefore influence men's perceived role and identity in the community or family, as well as our own perceived role and expectations. And this could be things such as men being perceived as strong, expectations in regard to success, men being seen as defenders of their families and communities and the country at large, men being perceived or expected to be problem solvers, and the perceived expectation for men to be the provider of the family. A man should put food on the table. With all these societal expectations, but also our perceived expectations, when we therefore experience loss, and I'm talking about loss in broader terms, and thinking about loss in terms of loss of a job, loss of a relationship, loss of a role in a family or a community, loss of a future one hoped for, loss of the man we wanted to be, loss of success we hoped to achieve or had worked really hard to achieve. When we experience that loss, we are likely to experience shame and defeat. This shroud of embarrassment may hinder help seeking,
Sorry, we still seem to be having some technical difficulties. Okay, try again.
Excellent. I hope that that was useful. Always good to hear from Ben, and I was just sorry that he couldn't join us today. But hopefully that's prompted some thoughts, some reflections. As I said, if you want to pop a question in the chat, that's great. Alternatively, if you click on reactions, and then beneath that you've got, or above that you've got raise hand. If that you prefer to do that to ask a question, we can do that as well. Just wanted to sort of follow up on some of the things that Ben has said while we're waiting for a hand to go up or for questions to appear in the chat. I suppose I should have said right from the get-go here that to some extent we need a trigger warning in that suicidality is part of the landscape when we're talking about men's health. Sadly, 75% of suicide in the UK is male, and as Ben said, the greatest prevalence is men in midlife. There are many different reasons for that. From societal expectations to about as Adil said, the services that are available or are not available or perceived to not be available. And the impact of loneliness, and I think it's one of those areas where there is a definite difference in how men and women seek help, how they conceive of their mental health, how they tend to think of things. So, for example, the language we use, men tend to not identify with feeling distressed, for example, but might say, well, I feel stressed. Stressed has connotations of sort of being too busy, having a lot on, being so responsible for so many different things that it's a natural element. Men may also be less inclined to suggest that they're depressed, and indeed when men are seeking help online, men will tend to use terms such as anger. They feel angry all the time. I think that feeling angry for many men is a way of expressing difficult feelings as a catch-all term that is congruent with a notion of masculinity, which is still sort of based very much upon the notion of control, emotions being suppressed, and anger with its sort of relation to sort of activity being something that men find more helpful, or rather palatable, because the opposite is then to feel sad, unhappy. And it's one of the reasons why I'm so engaged with organisations like the Campaign Against Living Miserably, who use very straightforward language, demedicalised language, in a way to engage with men. And I think we need to continue to do that. Any questions from the floor? Any questions for